咦？點解你唔食㗎？係咪唔多舒服啊？
唉，胃酸有倒流，有種鼻燒嘅感覺。
吓？點解你胃酸成日倒流嘅？係咪近排壓力大咗啲啊？
Perhaps the most common problem we are asked to address in gastroenterology is that of acid reflux, also known as GERD. This is something that occurs when contents from the stomach move upward into the esophagus, and we have a sphincter that's designed to protect us from that in the lower esophagus, the lower esophageal sphincter. When people have reflux, it can be due to a number of causes. The most common cause is a relaxation of that sphincter, which allows the contents to come upward. And we can see that occur more commonly with things like tobacco, alcohol, peppermint, chocolates, citrus, tea, caffeine. Other things can cause reflux, however, and they can be more serious in their implications. Ulcer disease or tumors in the stomach, something that prevents the contents of the stomach from emptying. So we have to take acid reflux seriously, even though it is a common problem. The kind of things that we see people presenting with when they have acid reflux may be chest pain that's not related to the heart, or what is commonly known as heartburn, even regurgitation, which is contents from the stomach making it all the way into the throat or the mouth, perhaps. But sometimes the symptoms can be a little more severe. We can see people have food that lodges in the esophagus. We call that dysphagia, trouble swallowing. They can also have pain with swallowing. Sometimes hoarseness or a chronic cough can be the way that reflux presents itself. But then sometimes there are complications which cause greater concern. Weight loss, maybe bleeding, the kind of things that we have to think about maybe considering endoscopy. So what I tell people to do is if these symptoms are mild and occasional, then we tell people to consider lifestyle modification, weight loss, avoidance of tobacco, identifying the kind of things in your diet that may trigger acid reflux and trying to avoid them. However, if you're having problems more than twice a week, or if you're having these kind of problems and you're over the age of 40, well then you need to see your physician. At the time of your consultation with a physician, lifestyle modification can be discussed. The kind of avoidance of things that may be making the problems worse may be considered as well. However, when you're over 40 or you're having these kind of problems twice a week or more, then endoscopy needs to be considered. And your physician may choose to refer you to a gastroenterologist where we can provide more assistance. We may choose to use endoscopy, imaging, or some other types of tests. Of course, along the way, proton pump inhibitors are the typical line of therapy, and they suppress acid and they can be of benefit as well. We have to remember that when symptoms occur, sometimes that's an early sign that something serious could be going on. So it can be a blessing, and you need to make sure you pursue that by seeing your physician.